In the case of chronic neck pain due to increased muscle tone of the upper traps or forward head posture, a TENS unit is a good modality to use. The benefits of TENS is it is good for pain control. It is also very cheap. You can buy this off of Amazon for about $40, and it's a small portable unit so you can take it anywhere. You can also wear this for a long period of time. We suggest starting for about 30 minutes and then increasing that time as you get used to the TENS. We suggest using this up to 3 hours. So this is what a TENS unit looks like. It comes with its own case, it is battery powered, and comes with its own electrode pad, so you can take it anywhere. And this one actually runs for a little less than $30. Do not use a TENS unit if you have a pacemaker, if you are pregnant, if you have active cancer, if you have a blood clot, if you are actively bleeding over the area, and your therapist or your physician should assess your sensation prior to using a TENS unit. We will move along now to the demonstration. Okay, so now I'm going to show you the procedure for putting a TENS unit. This is going to be for your neck pain due to upper trap tightness or forward head syndrome. So what you're going to do, you want to clean the area. You're going to put the electrodes off with an alcohol wipe. And then you want to keep your hair up too. It'll just make it easier so the electrodes don't stick to that. And you're going to put 2 on each side on the muscle, okay? So 1 here. Want to make sure it's all down. And then on the other side, just a little bit lower, about 2 inches apart. And then the other side. And then this one, a little lower as well. Okay, so we want to make sure that there's good contact on the skin, and you can even put some medical tape over it, so we make sure that it's all sticking down. Once you get that set up, so you have a total of 4 electrodes, 2 on each side, you're going to take your TENS unit, and you're going to put 1 channel on one side and the other channel on the other side. You're going to hook it up like so. And you want to make sure that these electrodes, that there's no space. They're all pushed all the way in. And same thing to the other side.
So, if you're okay with it,
once you get that set up, so you can adjust your TENS unit right here. And we want this about 100 and 100. So for the pulse width, about 100, and then for the frequency, also about 100 there, okay? Then you're going to open this up, and you're going to turn each dial at a time. You want to do this slowly. So when you first turn it on, you want to adjust it just a little bit at a time. And then once you get it to where you need it, you go to the other side, and just a little bit at a time as well. And then you want this to be at a strong but comfortable buzzing sensation is what it should feel like, and this will help with that pain control. And then to take it off, you want to make sure that both dials are turned all the way off. Close that, and then from there you can take off your electrodes. And then you're going to take your electrodes and you're going to put them back onto this plastic sheet so you can save them. And if they do become less sticky, a little bit of an alcohol wipe, just kind of dabbing on that, can make it stickier as well. After you're done using your TENS unit, make sure to turn the dials all the way off, as you do run the risk of shocking yourself from the electropads. You should also assess the area after using TENS. There should not be any redness. However, there is a risk of having an allergic reaction to the electropads. If you use a TENS unit and you have any of the risks or there is an adverse event from it, stop the TENS unit completely and notify your physician and your physical therapist. If you have any questions when using TENS, please contact your physical therapist or your physician prior to using this. Thank you.